Hello everyone, it's Melissa Sweet here from Croaky, and I'll let Professor Jane Mills introduce herself here at the National Rural Health Conference.
Thanks Melissa, I'm Jane Mills. I work at Massey University in New Zealand as the Pro-Vice Chancellor of the College of Health.
And you've been telling us at this conference that we need a new type of nurse, a nurse called planetary nurse. Can you explain what that is?
Thanks Melissa. Yes, look, planetary nursing, it's all about the impact that we have on the planet in our everyday working life. And the fact that every single nurse out there can be a planetary nurse. You can think about reuse, recycle, all those sorts of, sort of sustainability ideas that we have, that we think about in our everyday life, you can take into the workplace and actually start to think about the impact that we have in our use of disposables, the way that we interact with patients. There's a whole range of things that you can think about in terms of being an effective planetary nurse.
So you're not talking about a new discipline, are you? It's really saying all nurses can consider themselves planetary nurses.
That's right, Melissa. It's really a paradigm of thinking. It's how you consider yourself in terms of your impact on the planet and also your team's impact. So some of the things I talked about yesterday was the idea of forming a green team at work, where you actually get a plan together that thinks about what could we do to try and reduce our impact on the planet in our everyday lives.
Because what is some of the toll that healthcare actually does take? It is very, has high carbon emissions really.
It does indeed, and certainly our use of disposables, which has really ramped up over the last 15 years in comparison to the old days of actually reusing and recycling equipment, and so thinking about some of those things. It's a whole range of different things, even the way that we think about getting to work. So actually carpooling, biking, walking, there's lots and lots of different things that you can consider when it comes to your green team and what might fit in with where you are in the context of your practice.
And this is another way of bringing the Sustainable Development Goals, which can seem like a big abstract concept, into the everyday practice.
That's right. One of the things I talked about was the fact that the Sustainable Development Goals are really admirable. They're incredibly aspirational, but they also seem to be a very long way away from everyday nursing practice. So for planetary nurses, they can actually think about how they can make a contribution to the SDGs in their everyday life, just by considering, greening up their workplace.
And who needs to do what to enable planetary nursing to take off? Who are the people or organisations that can make this happen?
I think that our professional organisations have got a huge opportunity here. So nursing organisations such as Crana Plus, the Australian Nursing Midwifery Federation, the Australian College of Nursing, really need to start to put planetary nursing on the agenda and talk about some of the practical everyday things that their members can do in their own workplaces to make a difference.
And just before we wrap up, do you have any final reflections from the National Rural Health Conference? Any things that you'll take back with you to New Zealand?
I think that we've really talked about a whole range of things around climate this time, which is quite new. So I think that the discourse is starting to change around rural health. In saying that doesn't mean that we've solved all of the big wicked problems. I think that still many of those are a work in progress. But we are starting to really expand our thinking in terms of rural health and what that means for us and also for our consumers.
Thank you very much.
Thanks a lot, Melissa.